Good morning, Chicago. I'm Dr. Allison Arwady, Commissioner at the Chicago Department of Public Health, and as always, this is your opportunity to get your COVID questions answered. Today is Tuesday, September 7th, 2021. Hope everybody had a good Labor Day weekend. I certainly did. I was out at Navy Pier. There were a lot of people out, but doing a good job masking indoors and or being outdoors. Nice to see people out and about. Our goal, of course, is to remain open, but to keep being careful. So thanks to everybody who first and foremost has gotten vaccinated and then has continued to wear masks indoors. Remains a requirement. We're still seeing more than 400 cases a day. So as always, you can put your questions directly into the box below. You can also use the hashtag AskDrArwady on either Facebook or Twitter. We're going to look first at some data, and I pulled a little bit to get at some of the questions that a number of you have been sending in, even in advance of going live here, especially about natural immunity. And then we will get directly into your questions. So you can go to chi.gov/COVID- to get to our COVID dashboard for Chicago's numbers. And as we pull this up, you see that we're averaging 486 cases every day right now. That is essentially still flat. You can see we were averaging 483 a week ago. That's 18 per 100,000 per day. So a little over our 15 per 100,000 per day mark that pushes us into that higher risk territory. This is just the Delta surge, so you don't need to get exposed to as much COVID virus right now to potentially get infected. The good news is this really has flattened out. I'm very pleased to see that. The biggest worry we have always is when we're seeing significant increases in infection. We'll probably get over 500 here. In this surge that we saw back in April, May, when the Alpha variant came through, we got up to about 700 a day, but we didn't see anything like in the prior surges where we were up to 2,500 plus a day. So I continue to be very concerned about the U.S. broadly, although we're starting to see some improvement, particularly in the South. Hopefully that holds. Here in Chicago, we're averaging about 29 hospitalizations a day, 3 deaths a day. Those are flat, about 4,000 vaccinations a day, down just a little bit. Some of that is because of the 3-day Labor Day weekend, most likely. We did have some really actually good events for vaccination over the weekend. It was also Subilo, our last Protect Chicago music series, only open to people who are fully vaccinated, and that went very, very well. So thanks to everybody who came out for that. We're doing a lot of testing still, 12,000 a day. That might drop again a little bit just as we roll in the Labor Day weekend. But our positivity rate remains very good, 4.2% compared to 4.3% a week ago. We still have not hit 5%, so I'm very pleased with that. It tells us we're testing a lot. In parts of the country where COVID is in very poor control, we're seeing positivities over 10, and in a lot of cases over 20 and even over 30%. So I think, some of this flattening, I do think, is related to us putting those masks back on indoors. I know it's hard for folks if you've been vaccinated, but it's important for helping protect those who have not yet had the opportunity to get vaccinated. I encourage you to explore anything further on here. If you want to look at your vaccines by zip code, cases, deaths, you can look by age, etc. Very high level where we look at vaccines here. You see that about 71% of all Chicagoans over the age of 12 have had that first dose, and about 65% of all eligible Chicagoans have completed the vaccine series. And if we look by age here, we still have a ways to go. The 12 to 17-year-olds, we've been seeing the biggest improvements in week over week, and obviously with school coming back, we're seeing those numbers continue to increase, which I'm pleased about. But still, our youngest groups, both the 12 to 17-year-olds and the 18 to 29-year-olds, are under 65%. And then our very oldest, our over 80s, this is really not good. Only 2/3 of those over 80 and only 61% have gotten first dose, and only 61% have completed the vaccine series. That's really worrisome because the rate of death is so much higher for people who are unvaccinated versus those who are vaccinated if they do get COVID infection. And so we had shared a little of this data, and I think I'll bring some graphs on Thursday, but just to give you a sense of this, overall, where we look at all Chicago numbers, People are about 15 times more likely to die if they get COVID if they are not vaccinated compared to if they are fully vaccinated. But where you look at subgroups, like for example, Black and Latinx Chicagoans in that older age group, like the 55 to 64-year-olds, Black and Latinx Chicagoans are 35 to 40 more times or 35 to 40 times more likely to die than 55 to 64-year-old Black and Latinx Chicagoans who are unvaccinated. So really, especially in those older groups, the concerns are significant. So if you know someone with an underlying condition, if you know somebody who's older, it's especially important because right now there's just a lot of COVID around. This Delta variant is very infectious. It's now about 99% of all of the cases that we're seeing here. So if you're getting COVID, you're getting Delta at this point. And my worry remains not so much for those who are vaccinated, but for those who are unvaccinated, because the vaccines continue to do really well against hospitalization and death. So let's pull up just a couple of more data slides here. So first of all, let me go into slideshow mode, where we look at over time here, our case count does remain over 400 cases per day. But the increase has stabilized. And so you can see that 99% of vaccinated Chicagoans have not been diagnosed with COVID-19 after vaccination. Whereas hospitalizations here, you can see, you know, they're going up again, no surprise, averaging 29 per day. But 99.9% of vaccinated Chicagoans have not been hospitalized with COVID-19 after vaccination. And if you look at that graphically, going back to January, basically the first opportunity folks had to be fully vaccinated. Blue here shows you all COVID-19 hospitalizations of Chicagoans, and then red shows these breakthrough hospitalizations, meaning folks who have been vaccinated and hospitalized. So you can see we have started to see some more breakthrough hospitalizations. That's Delta. You just don't have to be exposed to as much COVID. And most of these folks, where we look in detail, they do tend to be older and have underlying conditions. But still, the huge bulk of people who are being hospitalized throughout this whole time, and especially right now, are, you know, continue to be people who are not vaccinated against COVID. And then similarly, deaths, you can see averaging about 3 deaths every day among Chicago residents. And so if 99% of vaccinated Chicagoans have not been diagnosed with COVID, 99.9% have not been hospitalized, and 99.99% have not died. So continues to be very, very protective. We also had a number of questions in. We had Wildcard on Twitter. We had Hector Lyon on Facebook, some others asking, what do we know about natural immunity? Wondering, you know, when will the city accept natural immunity instead of vaccine? And we might get into some more details about how we actually assess this, but I wanted to show you that we do definitely track at least partial COVID immunity, aka natural immunity, if people have had COVID here. So just to give you a sense of how we do this, and you're welcome to explore this some more. So these are Chicago estimates, and there's a number of simplifications in here. But first of all, on the left here, you see these are the age groups. So age 0 to 11, 12 to 17, and so on. Seroprevalence is an estimate at the state level. So this is across all of Illinois. What percentage of Illinoisans in this age group have had COVID and recovered from it, whether or not they know it. Seroprevalence means that there's big studies that are happening where people who have their blood drawn, sometimes for other reasons, this is all done anonymously, we also check for the presence of COVID antibodies. And there's a lot of lots and lots and lots of assumptions in here. There's different kinds of COVID antibodies. There's anti-spike and anti-nucleocapsid. Anti-spike, you'll get that antibody whether you were vaccinated or naturally infected, whereas the anti-nucleocapsid you'll only get if you've been infected. But nevertheless, this is sort of the best assessment. Now I'll tell you, downstate Illinois has been hit harder than Chicago, so we're probably somewhat lower, but we wanted to make an estimate. And then the next one, fraction immune from vaccination, this is what percentage of each of these age groups is fully vaccinated. And then our epidemiologists have done some work here to kind of assume what the fraction immune is. So you can see in 0 to 11-year-olds, none, 0% have had the opportunity to be vaccinated. So the estimated fraction immune, we might assume, would be 45%. And so fraction with some immunity from infection only, not as good as vaccination, but certainly some level of protection, you can see is different here in the different age groups. And so on the right, this fraction susceptible tells us what is the estimate broadly of Chicagoans who still have neither had any natural exposure to COVID and recovered and have not been vaccinated. So not surprisingly, it's highest among the children who've not had the opportunity for vaccine. But as you go down, you see what the different rates are. I'm particularly worried that almost a third of our Chicagoans over 80 do not have any sign in their blood, again at the population level, of immunity, even partial immunity from natural infection and recovery or vaccination. And across the whole city now, we estimate about 29% are susceptible. This was about 31% a few weeks ago, so it's moved a little bit. And then if you look at that by counts, you see this is how many Chicagoans still are fully susceptible. These are all population estimates, but it's almost 800,000, 791,000 Chicagoans still have had no exposure to COVID. And so my great hope is, except for the 205,000 children who have not been old enough yet, is that the rest of these folks, as many as possible, choose to get vaccinated. That's the safe way to build up some immunity and protection. And for folks who have had who have had natural infection but not yet been vaccinated, there certainly is some level of protection, but it's not as good or predictable or likely long-lasting as that comes from vaccine. I'm happy to take more questions about that if you want to put it in. The people who are in the best situation in all of Chicago are the ones actually who have both recovered from COVID and been vaccinated. There's some really good studies that have looked at bone marrow and the longer-lasting immunity that can develop. And so if you are lucky enough to have gotten through COVID, because we certainly have seen hundreds of thousands of people across the U.S. who unfortunately died. But if you got through COVID and you recovered and you are vaccinated, you are in the best possible position in terms of protection from COVID because you've had both of those versions. I also wanted to highlight that we are now able to offer a $100 Visa gift card to any Chicago resident who gets vaccinated against COVID-19 at a CDPH mobile vaccination event or at home. This is actually federal funding and a federal incentive and approval for this. So the way it works is if you get vaccinated through any of our events, if you go to chai.gov/vax calendar, you will see all of the locations where we're out and about. We continue to be at schools and churches and McDonald's and Swap-A-Ramas and flea markets and festivals and all kinds of places. But also, if you call at home, 312-746-4835, or go to chai.gov/at-home, you can sign up and we will bring vaccine to your house at a time that is convenient to you and give you the gift card. If you get the J&J vaccine, the single-dose vaccine, you will get a $100 Visa gift card right then. If you decide to get Pfizer, which is a 2-dose vaccine, you'll get $50 gift card with your first dose and then $50 when you get your second dose. So I hope that helps incentivize some people. We know that there are people who have still, we can come off the slides, have not made the decision to get vaccinated yet. And a lot of them cite they're worried about potentially lost wages or lost income or lost time. And so this is, some way to do it. One thing we've been really pleased to see is people getting together with their extended families, with their neighbors, and actually as a group calling for at-home appointments. So we've done, just over the last week or two, we had a group of 9 people, we had a group of 11 people, all getting vaccinated at one at-home appointment. And then yes, we are handing out then $900 or $1,100 of gift cards really in that context. So I think especially for people who are really struggling with meeting the basics and are worried. We hear this from in a lot of the really lower income neighborhoods. People are concerned, what if I get the COVID vaccine and I have some side effects and I have to miss work for a day or two, or I'm not feeling well and I have to pay for childcare, for my child for a day. Like this can really help, hopefully, cover some of those, what some people see as short-term barriers. Our biggest goal, of course, is not to incentivize people with money, but hopefully to incentivize with the fact that if you get COVID and get sick, chances are much higher, unfortunately, that you'll get hospitalized or die. And of course, that leads to much worse both income loss as well as potentially specific costs to your family. So anyway, that was a nice update, and we're hoping it will incentivize some more people to get vaccinated. All right, let's turn to your questions. Okay, Jean Brooks on Facebook is saying, again, reading about the emergence of very scary variants. What's the scoop on the Colombian variant? Will they tweak the vaccine? Okay, Jean. So for everybody, we are going to continue to see the emergence of new variants probably every few weeks. I've been saying this all along because viruses, not just COVID, all viruses mutate. And just because a virus mutates and we see a new variant emerge, it doesn't necessarily mean that it's going to have a significant impact for us here in Chicago. And the one you're asking about is called the Mu variant. And as a reminder, the WHO does assign these names, right? There's official names. B117 is sort of the scientific name of what was the Alpha variant, but then people have trouble obviously remembering those. And so they'll get a name. The WHO will say this is the Alpha, this is the Beta, this is the Gamma, this is the Delta, this is the Lambda, this is the Mu, this is the Epsilon, etc. But then there are these three levels of sort of how concerned we should be about a variant. So this Mu variant that emerged in Colombia has certainly been detected in the US. We've had, I know at least one case of it detected here in Chicago, maybe 21, I think, across Illinois. And they've seen it in most states. But it is not at this point outcompeting that Delta variant. The Delta variant is more than 99%. And really, if you're going to choose between, in my opinion, having a variant that's very contagious, like Delta, versus one that may be starting to, lose some of the immunity that you get from a vaccine, as long as it's not, the vaccine's completely not working. Really, the one that's more contagious is going to continue to outcompete it. So there are three levels, just as a reminder. There is what's called a variant of interest. And then variant of interest just means we've seen this crop up somewhere. It's interesting. It could turn into something that has major public health implications. We're not sure. We should monitor it. It gets a name. WHO declared Mu, this one from Colombia, a variant of interest. Then countries will also follow what's happening and will decide, is it a variant of interest here in our country? So actually the CDC has not even declared Mu a variant of interest at this point because it's not been behaving in a way that's been particularly concerning. It's not been outcompeting Delta. It's not been making people super sick. It doesn't mean it couldn't emerge, but right now it's not even a variant of interest in the US. Then there's lots of variants of interest. If we truly see a variant behaving in a way that's going to have significant public health implications, like it's a lot more contagious, like Delta, like it's making people a lot sicker, like the vaccine is not working as well against it, or some of the treatments, like the antibodies that we have, are not functioning well against it. Then there's a decision to go from a variant of interest to what's called a variant of concern. There have not been that many variants of concern: Alpha, Beta, Gamma, Delta. And so Mu is not a variant of concern at this point. Delta certainly is. You've seen how it's really run through the US and had major implications. And then there is a third level called a variant of high consequence. We have never had a variant of high consequence, as defined by the WHO, as defined by the CDC. If we got a variant of high consequence, that would be a very big deal. That would mean that the virus has mutated enough that something really different is going on. The biggest concern would be that the vaccine is truly not working, especially against severe outcomes. But also if it made people much, much sicker, or if it was, so much more dramatically contagious combined with making people sicker, for example. So if we were to get a variant of high consequence, that would be a big deal. That would almost, that would, depending on what the problem was, it would mean pretty different approaches in terms of what we might need to do as a society. Would we need to be vaccinating everybody? Could there be a possibility of having to really dial back on, things like school, et cetera, maybe even thinking about lockdowns? I very much hope not. But again, we've never had a variant of high consequence. If you hear about the variants, and I've been telling, we've been trying to educate a lot of the journalists about this, that just because there's a new variant, it's not really that interesting, because we have new variants emerging all the time. Variant of interest literally means, that's interesting, we'll watch it. Variant of concern means big deal, and then if we got a variant of high consequence, that would be a very big deal. So to your question, Jean, of what's the scoop on the Colombian variant? In Colombia, it was a fairly big deal. They saw it sort of emerge there, and it was showing some ability to escape some of the vaccine that was in place there, but it wasn't interacting with Delta in the same way. So will they tweak the vaccine? Every single variant of interest, or certainly variant of concern that emerges, scientists all around the world are testing all of the vaccines against those variants, and have not seen anything of major concern at this point. But the good thing is there is the ability to quote unquote tweak the vaccine if we get to a point where, especially if we had a variant of high consequence, to me, and it was for escaping immunity, that would be when you really needed to tweak the vaccine. So, sure, I'm interested in the Mu variant, just like I'm interested in the Lambda variant that was the news a couple of weeks ago, and the Epsilon before that, et cetera. If you go to our website, on chai.gov/COVID- brings you to the dashboard itself, but up at the top under latest data, we have a breakdown called variant of SARS-CoV-2, and you can go, we have some little videos from Chicago people in English and Spanish about variants, and you can look and see what are the proportions right now in Illinois, what are they in Region 5, which is the Midwest, what are they in Chicago. So if you're interested, I encourage you to go under latest data. Some of you have also been writing in wondering about hospital capacity. We've got a whole tab there. So a lot of, if you've got questions about data, that's really the best place to go. Breakthrough information is also on there. Okay. Kristen Korkowski on Facebook says, is it safe enough to travel to Iowa if you are fully vaccinated? I might want to make a road trip. Is Mu a concern? So again, Mu per se, which is this new variant of interest from the WHO, that's not one right now I'm super concerned about. My bigger concern is that for people who are unvaccinated, travel is just risky right now. Here in Chicago, we're averaging about 18 cases per 100,000 per day. But if you look across the country, it's more like 40 to 50 cases per 100,000 per day. So literally, twice as bad, 2.5 times as bad. You're welcome to check the CDC site or our own travel advisory to get some details. But reminder, that is especially for people who are unvaccinated. So you say you are fully vaccinated. I would feel comfortable. I was not one of the places that's like one of the, the worst in the country, which is really down in the southeast right now. And I would encourage you, if you're going to take a road trip, that's a good way to go. You can stay in your car, right? You're not exposed to as much of what sometimes people can be with public transportation. I would obviously encourage you to wear a mask when you're indoors. Just when you're traveling, there tend to be a lot of different exposures. But I think if you're fully vaccinated, travel with caution is okay. But if you're unvaccinated or you've got kids who are unvaccinated, I would not recommend traveling at that time. So I hope that helps. Our travel advisory, again, really applies to people who are unvaccinated. But if you do travel, you can take a test. You can take a test when you get back for a little bit of peace of mind there, and just have a little bit of extra caution around it. But I think a road trip, especially if you're being conscious about COVID risk, would be appropriate. And I would not be particularly concerned about mu. We will let you know as these new variants come if there are things that you need to be changing your behavior around. Catherine Bramlett on Facebook says, what percentage of people who contracted COVID did so before they traveled? Or because they traveled? So that's a really good question. We don't have it completely always broken down by that, because very often people who traveled have other exposures, right? And even during the time that they traveled, they're more likely to have participated in other activities that can put them at risk. So when people travel, we know they're much more likely to eat at restaurants. We know they're much more likely to be in crowds. We know they're much more likely to sort of be out of their regular routines and potentially exposed, depending on what they're doing, exposed to a lot of other people who, and so the risk for COVID can be higher. We have seen all along when we do our contact tracing and we call that travel absolutely is a risk factor, but it's probably not an independent risk factor. So, if someone is being very, very careful and they are like the question from the person who's thinking about a road trip to Iowa, if that person is going on a road trip to Iowa and she's going to visit, I have no idea, but family in Iowa, for example, she's vaccinated, they're fully vaccinated, they're planning to get together with a small number of people, that would be a low risk trip. Whereas someone who's traveling even somewhere like Iowa, but they're gonna fly or take a bus or take a train, they're gonna be through crowded stations, they're there for, I don't know, the Iowa State Fair or something, and they're like gonna be indoors a lot, and they're not vaccinated especially, would be a significant risk factor. So all along we have regularly seen when we are talking to people, Chicagoans I mean, that travel is for sure a risk factor. And across the whole country, we've just seen a lot of outbreaks associated with travel. Actually, just on Thursday, the CDPH in conjunction with CDC, we had an article come out that actually linked a big outbreak at a university campus here back before vaccines were widely available to spring break travel in that case, right? Which again, can be riskier travel. So I don't have an absolute percentage for you. I could pull, and maybe I'll bring next week, what our most recent is, where we're doing the case investigation, the percentage who report they travel. But it is always a fairly significant number. Sarah Garza on Facebook is saying, how long should you wait to get the flu shot after the second COVID dose? And also, are some medical procedures being put on hold due to the rise of COVID cases? Okay, Sarah. So first of all, there is not a requirement at this point to space out the COVID vaccine from any other vaccines. Right at the beginning, when of course the COVID vaccine was brand new and we were doing a lot of follow-up, there were worries about people having allergic reactions. We wanted to really have the opportunity to make sure that if people were having side effects, we knew which vaccine it was from. There was a recommendation to make sure that people got the COVID vaccine and had a certain amount of space on either side of getting any other vaccine. But for months now, actually, after additional studies and follow-up, that is no longer the case. So people absolutely can get the second dose or the first dose of their COVID vaccine, or if we have boosters recommended in the future, you could get that booster at the same time if you were due for it as the flu vaccine. So you do not need to wait after getting your second COVID dose to get the flu shot. You could even get it the same day if you wanted. We can't put those two vaccines in the same needle, if that makes sense. They are different vaccines. They are made in different ways. And so you might get the flu vaccine here and the COVID vaccine here. You have to separate them by at least an inch if people have to get them in the same place. But generally, I think some of this booster conversation actually is so, depending on what that recommendation is when it comes out, it lets us prepare. So flu vaccines are just starting to become available. They're in some pharmacies. They're starting to be in some doctors' offices. So everybody over the age of 6 months really needs to get a flu vaccine. Please, please. That's true every year. It's especially true this year because we know every winter we have a significant surge. We have sort of a crunch of hospitalizations for flu. And I don't want that big surge of hospitalizations hospitalizations for flu, sitting on top of what could be a surge for COVID. It's also bad news when we see people get both of these together, which can happen. So if you've had a COVID vaccine, you have no protection against flu. They are different vaccines, so you do need to get that flu vaccine. And the last thing I'll just say on that is for kids over, for children in particular, we really want to make sure they're getting their flu vaccine. So even if they're not yet eligible for a COVID vaccine, I don't want you waiting and saying, you know, maybe I'm just going to wait and maybe I'll have my kid get their flu vaccine in January because, you know, hopefully by then there will be COVID vaccines. No, please, we want them to get the flu vaccine before the flu season kicks in here, because young children are unfortunately more likely to have severe outcomes from influenza. Every year, you know, last year was an odd year for us with social distancing and masking, but in all years prior, you know, we see a lot of young children and a lot of older Chicagoans both be getting hospitalized. And most years we have pediatric deaths here in Chicago from influenza. So especially important for everybody, but older people and especially kids to get that flu vaccine. So age 6 months and up, everybody should get a flu vaccine every year. And if you've got more questions about that, put it in. And to your second question, are there some medical procedures being put on hold due to the rise of COVID cases? So not here in Chicago, there aren't, because we have good hospital capacity at this point. Across parts of the country that are having major surges, yes, there absolutely are. There are many, many hospitals that have had to cancel their elective surgeries, and in some cases have even had trouble doing elective and sometimes even emergent procedures. And there are hospitals that have had to, you know, helicopter people across state lines just to get them to somewhere that has capacity. So in Chicago, we have not at this point needed to pull back on procedures or kind of hold beds because of a COVID surge. And my goal is to hopefully keep it that way. But in parts of the US, unfortunately, that absolutely is happening with Delta, and it's happening in places especially that have low vaccination rates. Dee Ruiz on Facebook says, any update on kids' vaccines? So not anything official at this point. What I can tell you, I've been following this very closely, is that Pfizer, which at all points has just been a little further ahead in terms of its studies, is in the last phases, the last kind of few months here, of its COVID vaccine trial for the 5 or 6 year olds to 11-year-olds. The younger kids are a little further behind that. And so we could see from Pfizer possibly, you know, next month maybe some, you know, the data coming forward. It'll probably take a month after that for the FDA and the CDC to take a look. And one question for children is whether they'll decide to grant the younger children, grant the emergency use authorization or wait for the full authorization. So I do think we're looking at really later, sort of more toward the end of the year, being more likely for those school-age kids, and then not till next year, early next year, hopefully, for kids younger than that. So we'll keep you updated as we learn more, but Moderna is just a bit behind that. J&J's been doing some studies, et cetera. And so yeah, that's what we know. You know, 12 to 7, most important thing always for kids is that all the adults around them and the adolescents around them are vaccinated. That's the most important thing you can do to protect them. And of course, with adolescents, 12 to 17-year-olds are still not anywhere near as vaccinated as we'd like to see. So if you know an adolescent, please encourage them. They are also eligible for those $100 gift cards. Okay, some questions about ivermectin and other unproven treatments. You know, what should I say to doctors who are being asked to approve ivermectin? So if people are not familiar with ivermectin, it is a parasite medication. It is a medicine for worms, deworming, and it is usually used in veterinary medicine, so for horses, for cattle. And there has been a lot of interest in using this medication potentially to prevent COVID or to treat COVID. And I want to be really, really, really clear that In no case should anybody try to take a veterinary formula ever of any medication. And unfortunately, this is what we've been seeing. People have been trying to buy veterinary formulations of this deworming medication. So they're taking doses that are dosed for horses or cows. And we have seen people have liver problems and nausea, but like all kinds of issues. So first and foremost, do not ever, please, take any medicine that is formulated for animals. It's dangerous and it can really be a problem. So there are some trials that are going on looking at ivermectin, just as there have been trials of a lot of other medications. We don't have any evidence at this point, certainly, that it does anything to prevent COVID, just to be really clear about that. There was a very small trial in like 30 people that was like, oh, maybe there could be some help here. And this got sort of extrapolated out where people have gone a little bit overboard, I think, in terms of wanting to, before some of that science is done, use it. And, you know, I am a little surprised, I guess, that there are people who want to take a veterinary medicine that is not FDA approved, but then, you know, don't want to take the vaccine that has had, you know, really widespread human trials and is approved. So, really, you know, I was familiar with ivermectin because I worked in a lot of developing world settings where you sometimes do need to use it, again, as a parasitic treatment. And I would encourage anybody who's having serious signs of COVID, please don't wait. Go to your doctor and have a conversation about treatments. If you have been exposed to COVID, you are not vaccinated, and you are at serious risk of developing, you know, serious COVID, you're older, you have comorbidities, et cetera, there actually are FDA-approved treatments or, you know, prophylaxis. So there's these monoclonal antibodies that you can get. They're either through an IV or through subcutaneous injections. Those, there is some evidence, only for people who are unvaccinated, that there is some possibility, if you've had an exposure, of potentially preventing COVID. But there are no pills that have been proven to prevent COVID. And my worry is that if people are instead wanting to turn to, you know, some of these homeopathic or medicines that have not been trialed and have not been really checked for this, that they may delay seeking care for, you know, what actually is approved and recommended for people, you know, either treatments for COVID or even this post-exposure prophylaxis for people who are really high risk. The other thing is where we're talking to folks who have been exposed, you know, getting that vaccine, like this ring vaccine around people who have potentially had an exposure. Most of our contacts still at this point, when we're calling people, are people who are unvaccinated, and so wanting to try to get those folks vaccinated quickly, because if you've had one exposure, your social, you know, in your social network, there's a good chance, even if you don't get COVID this time, you might the next time. So I would really encourage anybody who is, you know, who has questions about these medications to first and foremost talk to your doctor, because there can be side effects of any unproven treatment. Even taking really high doses of some vitamins can be dangerous depending what they are. So, you know, have a conversation, and we will absolutely keep you up to date, just as we have all along, if there are any breakthroughs in any oral medications. We're still waiting for a good oral medication like we have for flu that can help actually prevent more severe infection if someone is infected, and just it's not been developed yet for COVID. So if we ever get good news on ivermectin, like, we'll be the first to be talking about it. But in the meantime, your doctor's not going to recommend it, and certainly you should never ever take a veterinary formulation of a medication. They also don't go through the same level of like FDA checks in terms of safety. So yeah, that's certainly a concern. And this is a little bit along the lines of what Justin is asking. Does Chicago intend on creating monoclonal hubs like in Florida? Early treatment of COVID is key to helping people stay out of the hospital. So the state has been looking at this. You know, again, the biggest protection by far is getting vaccinated. So in places where there are not people who are vaccinated and they're very high risk in the middle of a really big surge, these monoclonal antibodies can potentially help. And so if we were to get into a really significant surge, we might need to be having more access even than is available now. We already, in nursing home settings and some of these higher risk settings, already have the ability to use these medications as indicated, but the information continues to be good there. Like, we're doing a lot of these point prevalence studies, meaning we test everybody in high risk settings, in nursing homes, for example, and we're not seeing a lot of COVID because those are highly vaccinated settings. And so we have those treatments available if there are high-risk settings, but getting vaccinated is by far the most important thing. The last thing is, if you get those monoclonal antibodies, you actually can't get vaccinated for 90 days. And so that's also sort of a little bit of a trade-off in terms of, we really just want people to get protection. But yes, those treatments are available here in Illinois, and you should go through your doctor, please, if you've got concerns or you've been exposed and you're high risk for a bad outcome. Okay, so we are at time. I just wanted to let a couple people we're asking about the travel advisory. So because yesterday was a holiday, all of the sort of CDC national data was actually not updated yesterday. So we will be updating our travel advisory, and we'll put it out, either later today or possibly tomorrow. But I can tell you the whole country, except I believe Vermont, was on it last week. And broadly speaking, the huge majority of the country still remains on the list. We would want to see people stay under that 15 cases per 1,000 per day for about a week anyway. So I don't anticipate major changes. We may see a few states, on or off. But broadly speaking, travel remains a high-risk activity for people who are unvaccinated. So please just get vaccinated, and it helps you be able to do a lot more things with a lot less concern, and it helps us protect especially the most vulnerable people in Chicago who have either not yet had the chance to be vaccinated because they're too young or they're immunocompromised and the vaccine has not been as effective as it has for others. Or for the people who, for whatever reason, still have not made that decision. Our goal is just to, get through those 800,000 people in the safest way possible, and that really is going to be with a vaccine. So talk to anybody you know. If we didn't get to your question today, we will be back on Thursday. We're going to bring another expert in, maybe as soon as Thursday, to talk some more about variants, because we're getting a lot of questions. And people who are asking about safety studies like pregnant and nursing women, I refer you to the CDC page. Lots of good, not just for what the CDC says, but they link to studies, the actual studies that have been done for people who are pregnant, people who are nursing, people who are vaccinated. It's a good place to go to see, like we talked about on Tuesday, peer-reviewed studies, and kind of see how science evolves and develops. So that's what I would encourage you to take a look at. We will be back on Thursday. Thanks so much for tuning in. Be well.